evening, dear viewers. Today is World Mental Health Day, and the theme for this year is making your mental health a priority. The pandemic has left a huge mark on our minds, and this is reflective all around us in the emotions of rage, annoyance, panic attacks, and this is even extending to suicides today, unfortunately. In fact, in the last 2-3 days, I have heard about 2 suicides happen through my colleagues, ex-colleagues, and it's been very sad to hear something like this. So the theme picked by WHO this year is very much on target. So today we have with us Dr. Aishwarya Paranjpe, who is a clinical psychologist, and she has been practicing as a therapist for over 12 years. Welcome, Dr. Aishwarya. It's a pleasure having you on the Miind My Miind talk show, and on this day helping us understand a little more about this topic.
The pleasure is mine, ma'am. Thank you so much.
So dear viewers, let's hear from Dr. Paranjpe to understand why mental health needs to be a priority for us today. So let's start with, let's break this topic up into bits, and let's start with understanding what does mental health mean in our daily lives. Dr. Paranjpe, over to you.
So mental health is something that is very badly hyped these days. We generally think, oh my God, what is mental health all about? But to my mind, it would be nothing but how we feel, how we think about things, and how we behave. So how are our feelings affecting our behavior is something that would define mental health for me. But when mental health is getting affected, what does that mean? I would define it as, say, something like your behavior is affecting your day-to-day life. Maybe it's affecting your work, it's affecting your school life, it's affecting your daily relationships. And that would, for me, mean poor mental health.
Very bang on. I think you helped us understand in very simplistic terms as to, you know, what does it mean in our daily lives, because otherwise it is negatively hyped. You know, mental health bole to everybody thinks that, you know, koi pagal hai. It is not really pagalpan, but it is the daily thought process that we push ourselves through.
Absolutely.
So what do you think makes it difficult, or why do you think you know, people find it difficult to reach out to a therapist, you know, till the time it is already too late? Because I'm sure the start point is you know, is small, and if we were able to understand that start point and reach out to a therapist earlier, would it be useful for people to, you know, to keep the situation under control? What do you think?
Absolutely. Absolutely. So, see, basically, we are all very badly badgered, or maybe very badly, the thing has been hammered into our brains कि अगर कोई psychologist के पास जा रहा है या कोई psychiatrist के पास जा रहा है तो वो पागल है. Whereas in reality, there is nothing called pagalpan in psychology. Either you have schizophrenia, or you have depression, you have anxiety disorders, or you have some defined mental health disorder. But there is nothing called pagalpan according to psychology. And we are all
important. Sorry to interject. I think this is a very important facet that each one of us needs to understand and imbibe.
Absolutely. And the fact that we are all surrounded by this taboo, and it's been there for ages. And I hope that this is something that will go away in the years to come. I really hope so.
So, Dr. Aishwarya, what are the common signs that one should look out for? How do I know that I am in a poor mental health, or I am heading in the wrong direction?
See, mental health is not such a big deal, say something as basic as stress or feeling anxious or feeling low for a very long time is something that is the beginning of mental health issues. And maybe if we ignore them for a very long time, these could turn out to be, say, anxiety disorders or panic disorders, or maybe something as severe as schizophrenia, maybe. So I would say that it is something that we should look out for. Some basic red flags, like, say, are you feeling so anxious that you are unable to concentrate on something, or maybe are you feeling so uneasy that you are unable to speak to people? Are you feeling so uneasy and so low that you are unable to or unwilling to meet people? Are you isolating yourself? Are you seeing things which are not really true? Are you hearing voices? These are, of course, the more severe symptoms, but yes, they are absolutely there. And these are the symptoms of poor mental health, as I said, or maybe disorders pertaining to mental health.
So the red flags start as with these small aspects, and it's important for us to notice them not only in ourselves but also look out for people all around us. Any tips on how what should one do when someone notices these red flags? You see, it's very difficult for someone to tell another person to say that, what, I think you should see a counselor. How do we overcome that?
See, I would say that at the very basic level, even a friend or a family member can be a counselor. So what do you think? What do you do when you are talking out to people and those people are giving you solutions, or they are, suggesting solutions to you? And that is exactly what a counselor is probably going to do. Not exactly give you direct solutions, but perhaps give you a different perspective of your own problem. And that is something that we all need to do as a primary way of dealing with mental health issues. However, yes, it is very difficult for anyone to convince another person that you need to go to a psychologist. But of course, as friends and as relatives, it is our responsibility to make sure that maybe we need to go to at least a general practitioner first, and then perhaps the general practitioner could do the needful. As in, the general practitioner could probably suggest the next reference or something of that sort needs to be done. However, I would suggest some more preliminary ways of dealing with mental health. And those would be probably as simple as taking good sleep, or having good eating habits, or maybe being very positive about your thoughts. You see, thoughts are the basic ways in which our mental health is determined. So the moment you have a negative thought, it is affecting your mind, it is affecting your body, and you would be surprised to know that it actually creates a big change, a physical change in the neurological center, or at the neurological level. There are synaptic connections which are present in the brain, and these synaptic connections get changed with every thought. So if you are very negative on a very regular level, then the pathway gets set, and you start your thought process starts becoming more negative. However, if you are very positive in your thoughts, something that is called auto-suggestion in the layman's terms, then these positive thoughts are also something that can have a very positive effect on our mind, on our body, and also on our behavior and thought process. So these are the basic precautionary measures that we can take so that we do not reach the ultimate level of mental disorders.
Thank you so much. I think that was really bang on and helped understand and give us some insight onto what mental health can do and what these basic things, even as thinking positively, hum sunte roz hain, but we don't really follow them, but thinking positively, what kind of an impact that it can actually have on us. So Dr. Parantpe, thank you very much for being here today. Dear viewers, I hope you found it useful, and we look forward to having you back and liking our videos and sharing them ahead. Thank you.
Thank you so much. Thank you.